Hi, everybody, and welcome back to Butt-thotics Learn. Today, I'm going to show you how easy it is to use Butt-thotics on yourself or to help somebody else that you know that might be suffering from pain. So if you want to test someone else, um, there's some stuff that you should know before you try it. And we're going to get started here. So the Salter method, that's what I call it. Using orthopedic testing using Butt-thotics wedge to test for lateral pelvic tilt as a cause for back and neck pain and headaches. Can also be used to rule out joint and muscle pain, indicating more of a nerve involvement. So I also use it when I test people that come in maybe presenting with a shoulder problem or even a something that looks like tennis elbow. Sometimes it's not tennis elbow. And by when I level your hips and then we do the pain motion again, the pain is diminished or gone because it's not actually the shoulder musculature, possibly. It's probably a neck problem, a nerve pinch. Okay. So, oh, okay, we're going to do, well, I'm going too fast here. So how to use the Salter method and Butt-thotics wedge to correct a lateral pelvic tilt in seated position to decrease pain and headaches caused by overstretching of peripheral nerves, spinal cord, and brain stem. Yes, because all of that gets pulled down with a lateral pelvic tilt because you have your hips, but in your hips again, you have a bunch of nerves that are coming down into your hips. So if your hips are like that, it'll actually stretch all the way to the top. That's why somebody's headache could disappear by just sitting on the wedge. Um, so caused by overstretching peripheral and brainstem. Also to decrease possible damage to joint muscles due to the asymmetry in posture. So when you're unlevel, everything is going to get used differently, right? If you have a good posture and you're symmetrical, which is pretty much impossible in anybody, you won't wear your joints as easily. But when you're off, then one joint gets used more than the other. Okay, so to be used by health professionals in practice, may be used by laymen as well. Okay, risks and benefits of testing and prescribing for treatment. So anytime you do any kind of medical or health intervention, there's risks and there's benefits to treatment. So let's talk about that a little bit. I don't go too fast here. No, let's go too fast. Okay, be aware that testing can bring on symptoms of pain, headaches, and other unusual symptoms if used incorrectly. Stop testing immediately if patient is experiencing more pain or unusual symptoms. Sometimes, like it can get rid of headaches, but it could possibly cause one. It depends what's going on in your spine. If something is really twisted, or there could be anchoring of nerves in your, or even right beside your spine due to tight tissues. So something like that can change the symptoms to be not as good, um, or be worse, or maybe it'll cause something else. But most of the time, what it does, it'll level you and then uh, decrease your pain and your symptoms. Must obtain informed consent either verbally or in writing. So when you are going to try this on somebody else, you got to let them know that there's risks and benefits to this treatment. And sometimes we can create more pain, right? If something is going on. But normally this works great and it's instant. If patient is not noticing difference or improvement while seated on Butt-thotics wedge, please do not prescribe for use as treatment. So if you don't feel it, don't use it. It's always best to do it when you have a headache or you have pain, and then you'll notice right away. But if you don't have any symptoms, then it's hard to tell. Although sometimes when I will level somebody, I'll put the wedge under the proper side and then I take it out and they'll tell me, oh, I feel unlevel now. So, but you just got to be careful. I prefer to do it when the person is already experiencing symptoms. Um, and again, these tests will have better results if patient is experiencing pain, headache at time of testing. Always test wedge under left and then right side to be sure of which side is correct. Using only visual markers leaves much room for error when observing the level of hips in the patient. I've done this quite a few times. Most of the time I'm good, but it's hard to tell. It's not like measuring a leg or anything. So it can be hard to tell when somebody is seated to tell what side is lower than the other. So it's best to just put it under one side and see how it feels, and then try it on the other side and see how it feels. Um, Patient will feel results immediately. Yes. If this helps you, if you have a headache, I've seen it. I don't know how many times it'll go away right away. You'll notice a change right away. Um, if patient gets relief from using Butt-thotics orthopedic wedge, it is best if used while sitting most of the time, as much as possible, right? Test for back pain and headaches caused by lateral pelvic tilt seated. So you need a Butt-thotics wedge and a chair of regular height. Do not use stool or chair with too much cushioning, okay? Because the wedge is made kind of a hard surface. It's a hard material, or harder than a chair. If it's too sinky, the chair, it's not going to work as good. So like an office chair is good, a kitchen table is good, then nothing like a stool. That's too high. You want to be seated more at a 90 and a 90-degree angle. So if this is your back, that's your leg, upper leg, and then like that. So you want to be mostly at a 90 and a 90. Um, Client seated, do you feel any pain or discomfort while seated? Do you have a headache? If yes, to either question, perform the test. Have patient stand and place wedge at back of the chair. So, do I have one right here? Yes, just a minute. So take the thicker part, so it's thinner at the bottom, it's thicker on top. So you want to place the thicker part at the back of the chair. Have patients stand and place wedge at back of chair with thickened part at the back of the chair on either the right or the left side of chair. Have patient sit back down on chair and observe patient's reaction. Then have the patient stand up and place wedge on other side of chair. Observe patient's reaction. The patient will usually know which side felt better. Place wedge on preferred side and ask patient if symptoms are diminished or gone. If yes, use of Butt-thotics wedge is then indicated. So you'll know, and if you don't know, you're unsure, you shouldn't do it to anybody else if you're unsure. But if you're unsure when you're trying it, you should wait until you have symptoms. Then whichever side you like, use it on that side. If yes, use Butt-thotics. Use of Butt-thotics wedge is then indicated is positive sign of problem being due to lateral pelvic tilt seated. Also indicates involvement of excessive stretching of peripheral nerves, spinal cord, and or brainstem, depending on the patient's symptoms. If there's no improvement of symptoms or pain, do not prescribe use of Butt-thotics. If pain is decreased, but patient starts to feel new unusual symptoms, discontinue use. Yes, sometimes it helps the pain right away, but then all of a sudden it might create pain on the other side. That's pretty rare, but it does happen. If Do not automatically assume that the wedge should be used on the side of the pain. That's a big one. A lot of people forget what side I told them, and then they'll use it on the side that they have pain. It's always different. I'd say a lot of the times it is on the side of your pain, but a lot of the times it's not. So you really have to try it, okay? And yeah, go to none. Additional information. It is common for people who suffer due to a lateral pelvic tilt to say yes to some or all of these questions. Do you have pain when getting up after prolonged sitting? Then pain goes away after taking a few steps. That's a big one. I hear that one all the time. That means overstretching of nerves for prolonged periods can cause ischemia and irritation to the nerves. So when the nerves are over pulled like that, They don't get blood flow as much, and it actually deteriorates the nerve tissue. So when you stand up uh, and take a few steps, blood flow can return. So at first you get up and you go, oh, at the, low back pain, and then you walk for a couple of steps, and then everything's fine because it went back to normal. It's getting blood again. It's happy again. But over time, that can cause, right, deterioration of nerves. And then, so you stand up, blood flow can return to the nerves and bring instant relief when using Butt-thotics to level. Blood flow can return to nerves and bring instant relief. So once you stand up and you stop stretching the nerves, they can get the blood flow and they're good again. So when using Butt-thotics to level the hips and stand from sitting, there is no longer overstretching. So once you're level, we're not overstretching those nerves, so you don't have that problem anymore. I don't have that problem anymore, and it's been 2.5 years. Um, uh, so next time, after sitting on the wedge for a while, you shouldn't have that problem anymore. Okay, do you have trouble pain when walking on uneven ground? That's a big one. A lot of people tell me, like, say in the backyard, they have trouble walking, it hurts. That's probably because of your uneven hips. Um, Someone with lateral pelvic tilt may experience this. Using a wedge insole in one shoe only, like the seated wedge, will often feel better when walking on uneven ground. Also, if patient has pain when walking on side of the road, the problem may be due to the slope of the road and your hips tilting to the same side, creating an increase of your symptoms of your tilt. So if you have, so I often tell people, like, if you're in the backyard and you're on a bit of a slope or walking on the road and you start having pain, some roads kind of slope that way. If you're already tilted that way and you have a lower hip, you're just going to exacerbate that tilt. So I tell people to go on the other side of the road and try that side, and that feels better. Or if you're on a slope in the backyard, let's say you're like this, you got one foot on this low part and one foot on the higher part, I tell them to flip around and see if that helps. So sometimes people actually need a wedge in their shoe too. Um, the problem may be due to slope. Try walking on the other side of the road and see if your symptoms go away. I've done this with I don't know how many clients. Um, One in particular, I can remember, she walked her dogs, a 40-year-old woman walking her dog, and she has a left lateral pelvic tilt, so her left hip is lower, and she couldn't even walk her dog anymore. It was so painful every time she'd take it for a walk. She'd been to the doctors, had scans. They just say it's arthritis and there's nothing you can do. So I just told her to put a shim in her left shoe. And she called me after her first walk and called me a genius, right? So it doesn't work for everybody, but you'd be surprised at what these little things can do. Um, Okay, so do hard surfaces, standing, sitting, aggravate your problem? Hard surfaces like cement floors. How many people work on cement floor? If you work in a school, if you work in a factory, a lot of people, even in an office building, they're all cement floors, right? And a lot of people, there's no give. So when you have problems with the lateral pelvic tilt, it's just like sitting on a hard chair, a kitchen chair. A hard surface irritates it more. Same with a hard surface um, walking. So if you have a lot of pelvic tilt, often I will hear some of these comments. So remember okay, do you have trouble with pain or odd symptoms when showering? You'd be surprised how many people have trouble. And they say it's the heat of the shower, whatever, but again, the shower or the bathtub that you're showering in slopes, right? It slopes towards the drain. So again, same thing. You want to try and maybe flip your feet to the other side to see if that helps, because you probably already have a neck problem and this makes it worse. And if you're actually you're exacerbating your tilt, you're going to make that worse. And in a lot of people, it actually works. They'll switch their foot position, and their showering is a better experience. It's great. Is all your pain on one side of your body, either the left side or the right side? Oh, that's probably the number one I hear. It's always all one side. I never understood it, but this is how I explain it. This is a very good indicator of lateral pelvic tilt and overstretching of nerves. Remember, there is a cable attached to your brain. That cable spinal cord can be pulled down with a lateral pelvic tilt and cause irritation to peripheral nerves as well. And it'll be pulling all the way down. So why else would you have all one-sided problems? Unfortunately, Butt-thotics doesn't work for everyone. I find it doesn't. If it doesn't, it's probably because they have a problem somewhere in their spine. Again, you can have a twist in your spine. You can have anchoring somewhere in your mid back where there's no give of the spinal cord, and the peripheral nerves that come out are stuck there. So when that happens, you can cause stretching from that point up or stretching from that point down. So depending on what's going on. So for some people it doesn't work, but I believe that for most people it does. Overstretching. Remember, there is a cable. Okay. Unfortunately, Butt-thotics doesn't work for everyone. I find it doesn't. If it doesn't, okay, we've already been there. Can be some tethering, anchoring nerves from tight muscles of neck, back, or fascia. Could be some twisting of a vertebra or subluxation, which can again anchor. Something is just not sitting right in the spine. Okay, and for any questions pertaining to this, please contact us at info@Butt-thotics. And yeah, and here you are on Telegram or YouTube joining me for this. So I just wanted to share that with people. It's really easy to use. You just try it on either side and see if it works. And try it if you have symptoms, and you'll know right away. It's that simple. Now, yeah, so thank you very much. I'm going to come back with another video shortly there in the next couple of days because we're going to finish the headache videos. We're going to do videos about the back of the neck. Okay, thanks a lot.